Have you seen any statistics about burnout as it translates to private practice versus employment, or
Yes.
what is
Yeah.
that?
So there is, so satisfaction with medicine, right, as a profession. And again, that's just to sidetrack a tiny little bit. When you treat medicine as a profession, you make certain decisions. When you treat medicine as a job, then you make other decisions and you feel pressure. There are different pressures, right? And I think that's again part of that discord that we were talking about before. So, but in terms of satisfaction with being a doctor, there's higher satisfaction among independent practice physicians than
Mm.
employed physicians. There's also higher satisfaction in physicians that are over 40 years of age than those that are under 40 years of age, which is kind of interesting. But I think that also reflects that there's probably more employed doctors
Yeah.
under 40, right? Because that's kind of the pipeline that's happening right now. So, it's human nature. I mean, that translates into probably most businesses, that at some point have to pick which one suits you best. Do you want to be the owner or do you want to be the employee?
And I would guess that the ultimate compensation is higher as well in private practice. Maybe not early on, but
I don't think that's necessarily true.
no.
So no, I think that when you look at compensation, I mean, you know this better than I do probably, but compensation as an employee may be your salary, but it also may be that they cover your malpractice insurance and they
Mm.
provide a place for you to work and they provide, so there are all these expenses that you're kind of paying for, but not really. So you have X amount of dollars to take home.
Right.
Whereas when you're the one providing for all those things, the numbers may be a little bit bigger individually, but it ends up being the same, right? But at least
Mm.
you have the opportunity to do more. But I don't think that employment salaries are pretty good,
Mhm. Oh yeah, it's hard to,
you know?
especially, I mean, if you're a very, very productive, like from an RVU standpoint, physician, like that becomes impossible to replicate in some ways because the hospital is just,
Well, so yeah, and so you mentioned one of the words. I don't know if your audience, if they're familiar with the whole RBU, that whole payment system. But again, the RBU or the value that that physician is providing the hospital, right? So the neurosurgeons are a very large revenue stream for the hospital, right? So they can afford to incentivize the neurosurgeons with bigger salaries than that's why they got rid of the pediatrician, right? Pediatricians basically use E&M codes that are all just office visits, which are very low generating for the system, right? However, as a person, as a doctor, you can make that work in your own business. It's just that for the hospital, you're costing them more than they are getting from you. And that's why they got rid of all the primary care doctors. At first they thought, well, the referrals into the system would make up for it. And it turns out the doctors are going to refer to whoever they want to anyway,
mhm.
right? And they were costing them money because they don't generate much as a family practice doctor for the system. But as a doctor or as a group of doctors, you can be fine financially, you
Mhm.
know?
I work with a lot of physicians, and I don't think I can think of one single example. Maybe I can think of one where they started a practice right out of training. It's extremely rare. I think it used to be common back in the day. I imagine it did a long, long time ago, where that was just because that was just the way that people did it. But I know dentists, for example, as a comparison, a lot of them do start their own practices, sometimes just straight from scratch, right out of training. But I'm kind of an entrepreneur lean type personality, and I love the whole. I'm a big believer in entrepreneurship, and I think a lot of these problems get solved when you put good entrepreneurs at it, and small businesses, and young people are some of the smartest people and haven't been kind of squashed yet. Like they still kind of have a lot of creative ideas. And I feel like the more young entrepreneurs we can get in medicine will help to solve a lot of these big giant healthcare problems. but it's just not happening. Like I just, it seems like it's extremely rare, especially the youngest.
Well, so dentistry, part of the reason that what you described is so much more common is that they avoided the third-party payer arrangements for much, much longer.
Yep.
Right. So dentistry is it's like veterinary medicine in the sense that most of it is cash, right? So
Yep.
the patient is paying for the service that they're getting from their dentist, right? Medicine fell into the trap of a third-party payment system a while ago. So that leads to a lot of the issues that eventually translate into some of the things we've already talked about, is that how do I duplicate what I see, which is this giant system? And it's very daunting. However, a dentist coming out of dental practice has had mentors their whole training, which are doing it
Right.
in the way that they say, well, I can do that. They'll show me how to do it, or I'll join a practice and then I'll eventually take over the practice, which is what medicine used to be like, right?
Mm-hmm.
But they're in control of all that because they're not beholden to a lot of other regulations. I mean, you know what I mean, in terms of insurance payments and
Right.
government regulations and all that kind of stuff. So I think going back to the same thing is, if we can get medical students, physicians in training at different levels exposed again to private practice, there will be a subset of them that will. The other side of this is really that more the patients demand that, the more of that there's going to be, right? So, again, given a choice, patients prefer the old setup of, they can go in and see their doctor and they know who they're seeing and all that. There are a lot of things that have to change from the patient's point of view. Insurance benefits, I mean, it's very multi-layered, but again, you don't have to change the whole thing. My whole involvement in all of this has always been to just try to open doors so that people can have a choice, an alternative to the system. So
If I'm listening, I'm in training, and I am kind of like, we've struck a curiosity with them in terms of like this whole private practice idea, but they also are like, yeah, but what you're saying is right. Like all my people around me are not in that, and I don't even have, nobody around me is doing that, and like I just don't see the path. Do you have any suggestions for them to like find a source of education or influence outside of that?
That's the biggest softball that you've thrown all day. So join indie docs. So go to www.indiedocs.com, Independent Doctors of South Carolina, and that is part of what we're trying to build.